Hello, my name is Sarah Jones, and I am going to be doing a presentation on auditory processing disorder. Auditory processing disorder is a disorder that affects the ability of one to understand speech. It is not a problem with the ear, but it is an issue in the brain. Individuals with auditory processing disorder have difficulty with one or more of the following skills. Auditory discrimination. This is the ability to notice and distinguish between distinct and separate sounds. Figure to ground discrimination. The ability to differentiate important sounds from background noise, to follow verbal instructions or pick out one voice from the auditory clutter. And auditory sequencing. This is the ability to understand and recall the order of sounds. And auditory memory is the ability to remember things we hear in both the short term and the long term. The causes of auditory processing disorder are still not known. It can be linked to chronic ear infection, meningitis, lead poisoning, brain tumor, stroke, or multiple sclerosis. It's linked to premature birth. It can happen when there's an injury to the head, or it can be a genetic thing that's passed down from parent to child. So, the course of the disorder starts with recognizing that it is there in an individual. It's often first noticed in young children. When adults develop it, it normally has to do with an injury, like a stroke, a head injury, or a disease like MS. In children, parents or teachers may notice the child not following directions or asking things to be repeated multiple times. And then there is testing. And it's not as easy to test for auditory processing disorder as testing for a hearing impairment because, again, it's not a problem with the ears. So there are electrode tests where a subject listens to sounds and electrodes and measure the brain's responses. There are speech and language assessments, and there are cognitive assessments. Auditory processing disorder cannot be treated with medication. However, speech therapy can help individuals with this disorder with the ability to distinguish sounds and increase their auditory memory. Auditory training focuses on where a noise comes from or on specific sounds while background noise is playing. It can also help improve the abilities of one with auditory processing disorder. So the impact on a person's life will vary depending on who gets the disease. Mostly it's in children, and when they have auditory processing disorder, they will have difficulty interpreting what they're hearing, and it can be a problem in the classroom setting. And it can also just be a problem with them communicating with their friends or family. And adults can struggle with the similar kind of issues of understanding directions and just in general communicating with people. In a classroom, a teacher could use visual aids to help them understand. They can be seated near the front of the classroom. The teacher will make sure to speak clearly and slowly, and noise should be diminished as much as possible. If you come into contact with someone with auditory processing disorder, you should get their attention and face them before speaking. Speak clearly and slowly, and do not speak in a monotone voice. It's much easier for those with auditory processing disorder to understand what is being said to them when the correct words are emphasized or parts of words are emphasized, and it's very emotive. It's much easier for them to understand. And if they ask you to repeat something, you should do it without getting frustrated, or you can, after you say something, you can just ask someone if they understood what you said. And the outcomes are, if an individual with auditory processing disorder gets the help and support they need, it becomes less of a problem over time because they build the skills they need to overcome the disorder. Many children under 13 who have it, if they get the right help, can just kind of grow out of it. Anyone with auditory processing disorder can become just as successful as anyone else. These are my resources. Thank you so much, and I appreciate you listening.